Chapter 6. Aseptic Garbing, Hand Washing, and Gloving. The learning objectives for Chapter 6 to explain best practice as it applies to sterile compounding, compare and contrast early concepts of germ transmission and current procedures for aseptic garbing, hand washing, and gloving, describe the procedures for aseptic garbing, hand washing, and gloving according to USP Chapter 797 guidelines, and evaluate procedures utilized in maintaining asepsis during aseptic garbing, hand washing, and gloving, including identifying breaks in procedure and the corrective action. Aseptic technique begins before the act of preparing the sterile compound. Proper garbing, hand washing, and gloving help to avoid introducing pathogens to the sterile products. Sanitation, cleanliness, and infection control are more of a modern thought process. Many concepts were introduced in the late 1800s and have been continuing to evolve to the standards we observe today. Current sterile attire reduces incidence of nosocomial infection. Nosocomial means hospital-acquired, hospital-borne, or healthcare-associated infection. The goal is to prevent the introduction of pathogens or disease-causing microorganisms while working with sterile compound products and supplies. Maintaining asepsis in product preparation is critical for the hospitalized patients receiving these CSPs. These patients are already compromised. They're already ill. We do not want to introduce another source of infection. Correct garbing, hand washing, and gloving are the important safety measures for those preparing these products. Before beginning the sterile compounding process, IV technicians must assess their own physical appearance for any violations. A compounding technician may not wear any cosmetics, hairspray, perfume, artificial nails, or nail polish. These are chemicals which could interact. You must remove any jewelry, including any body piercings that are not covered by a gown or a mask. You must keep your fingernails closely trimmed to make it easier to clean the bacteria from under your nails. Also, you should have no weeping sores, any sunburn, rash, or respiratory infection. All of these are potential introduction for any contaminant. Cosmetics, hairspray, those can flake off. Sunburn, skin cells can flake off. A respiratory infection, a cough could spread contaminants, virus, or bacteria. And jewelry, it's a harbinger for bacteria and dirt. Sterile compounding personnel begin the process of donning PPE, which is personal protective equipment. This helps minimize the risk of contamination of the sterile compounding area and the compounded product. In addition to donning the PPE, the IV technician also performs an aseptic hand washing. This is a hand washing procedure that is more stringent than a basic hand washing. I would like to note at this time that the hand washing procedures that you will observe will depend upon the policy and procedure manual at the location where you will work. There are several different versions of an appropriate hand wash. The one we will do in lab is considered to be best practice. When preparing for aseptic hand washing, the first step is garbing. In the aseptic garbing, the technician will prepare to work by donning shoe covers, hair cover, and a face mask. Again, I bring to light that it will depend on the policy and procedure manuals at your work location as to which item is put on first and what the sequencing is. Reviewing the types of equipment or supplies included in your garbing are a hair cover, which is commonly referred to as a bonnet. The option for hair covers include disposable caps and washable caps in surgical or bouffant style. The ones that are pictured here are bouffant, and this is what we use in our lab. Following best practice, the garbing sequence is to first sanitize your hands with sterile foaming 70% IPA before donning any PPE. Another piece of essential supplies for garbing include the face mask. Pharmacy personnel wear face masks to catch bacteria held in the liquid droplets and aerosols that come from your mouth and your nose. Any IV technician with facial hair will also be needing to wear a beard cover. In between each PPE, the IV technicians should sanitize their hands. The type of mask that a technician may use will be either a tie or an ear loop mask. You want to ensure the folds on the mask are facing down. The illustration here has the mask upside down. The top of the mask will have a pliable metal strip so that you can fit it snugly over your nose. If appropriate, don a beard cover before putting on the mask, as illustrated in this lower picture. Depending on your policies and procedures, you will either don the bonnet first or the shoe covers first. Again, before either, you will use the 70% isopropyl alcohol foam. IV technicians should wear closed-toed shoes because of the potential for injury by needles or broken glass. Clean, well-fitting walking or running shoes are a safe option. Sterile compounders need to place disposable shoe covers over their shoe to keep dirt and other substances from contaminating a clean room floor. After donning the personal protective equipment, hand washing will occur. Aseptic hand washing, again, is a little bit more stringent than your regular hand washing. IV technicians will wash their forearms and hands using an appropriate antimicrobial agent and following a specific sequence. Your policy and procedure manual will outline what is appropriate hand washing. Some of the newer standards may include a hand washing that will last up to 6 minutes, with 3 minutes on each hand. Special attention should be paid to areas that harbor multiple microorganisms, including under the fingernails and in the creases of the skin, especially in the wrist. Learning this process is critical because the most common source of contamination in the preparation of parenteral products is touch contamination, which occurs when a healthcare worker has inadvertently touched something that should be sterile. The following situations require the completion of aseptic hand washing: when first entering the sterile compounding area, when re-entering the sterile compounding area, after eating, after using a restroom, after sneezing or coughing, after a major contamination such as a needle stick or a drug spill with a volume greater than 5 milliliters, or after the hands have touched any item that is obviously contaminated, such as the floor, a waste receptacle, sharps container, or a visibly soiled item. Each commonly used type of hand cleanser has benefits as well-defined uses, and compounding facilities choose the types that suit them best. Facilities should occasionally change their type of hand cleanser to help prevent any kind of resistance. Hand cleansers include chloroxylenol, which is effective and common cleansing, appropriate for aseptic hand washing; chlorhexidine, which is also a common appropriate cleansing agent; isopropyl alcohol in the form of rinses, gels, or foams. Those are used between uses. Those are used prior to donning PPE and between aseptic hand washing procedures when there's a minor hand contamination, such as when you touch your label or adjust your eyeglasses. The next two aren't used generally in an aseptic hand washing. Iodophores, such as povidone iodine, is an antimicrobial agent, but it can be a skin irritant, so it is not necessarily appropriate. We use it only when there's nothing else available. Triclosan is found in household soaps, and today actually it's even difficult to find it there. It's been removed from most things. It's not appropriate for aseptic hand washing. In certain situations, sterile compounding personnel may cleanse their hands or gloves with sterile foaming 70% IPA. That would be upon entering the anteroom prior to donning the PPE, after using a calculator or a pen, if there is a small spill of a few drops of liquid on a gloved hand, or when there's a potential for minor hand contamination, such as after adjusting eyeglasses or handling labels or a medication order. After hand washing has been completed, sterile compounding technicians will put on their last 2 PPE items, which include a sterile gown and a pair of sterile gloves. Because humans shed more than 1 million skin cells every hour, we wear the gown and we wear gloves. These skin cells can harbor multiple organisms that can contaminate sterile products, which can endanger the patients. An IV technician who has aseptically cleansed their hands will don sterile gloves to compensate for 2 possible scenarios: the ripping or puncturing of gloves by a needle or glass shard, and the growth of microorganisms on poorly cleansed hands that are enclosed in a warm, moist environment of the gloves. These microorganisms can seep through micropores of the gloves. Because the IV room is generally kept at a cooler temperature, IV technicians should layer their attire so it is appropriate for the warmth level. Also, comfort and practicability. IV technicians should be wearing clean scrub. They must wear either sterile lint-free disposable gown or a gown that has been freshly laundered and sterilized by the hospital's laundry department. This should completely cover the front of the technician and have a secure neck closure, as well as tie in the back and fit snugly around the wrists. Technicians should don sterile, powder-free gloves. Synthetic, non-latex gloves are available for people with latex allergies. Again, according to protocols, you may not have access to sterile gloves. If this is the case, you would don non-sterile gloves, which you would need to sanitize using 70% isopropyl alcohol. As a general rule, the size of the glove the sterile gloves follow. A size 6 would be a small, a size 7 or a medium, and a size 8 would be considered large. The gloves should be close-fitting to allow for maximum finger dexterity, but not so tight that they compromise the circulation or cause discomfort. Gloves are one-time use only. When completing an aseptic hand washing, there are certain procedures that are necessary to follow. USP Chapter 797 regulations describe the features and locations of a sink designated for aseptic hand washing. These are designed to minimize splashing and reduce possible contamination. The sink must be located in the anteroom or just outside of the door of the clean room. It should be deep and it should have a gooseneck faucet. The foot pedals should be used. If foot pedals are not available, personnel must let the water run throughout the entire scrub and rinse procedure, then turn off the faucet with a lint-free paper towel. If a foot pedal is not available, other types of sinks operations that do not require touch by the hand may include an electronic eye. Additionally, the faucet itself, if it is hand-controlled, may have a large winged hand control that could be adjusted with your elbow. The sink needs to be clean and free of any item that could cause splashing, such as sponges or IV bags. As a sterile compounder, you must perform the basic hand washing. This includes vigorously washing both hands and forearms for at least 30 seconds with an antimicrobial agent. Following policy and procedures where you work, you may be required to do a more in-depth type of cleaning. Many facilities prefer to perform the hand washing procedures using a sterile prepackaged surgical scrub sponge brush that is pre-saturated with an appropriate antimicrobial growth. This is the type of practice that we will do in lab. Let's review the procedures. Upon entering the anteroom, preparing to produce aseptic products, the IV technician will garb. That includes putting on a bonnet, a face mask, and booties. The technician will then complete an aseptic hand washing, and they will then complete the donning procedures by putting on a gown and lastly their gloves. Removal of the PPEs occurs in the opposite order as to which they were put on.